In this video, we are going to demonstrate how to don and doff PPE when using a P2 N95 respirator for the care of all suspected or confirmed cases of COVID-19. Appropriate PPE for contact and airborne procedures consists of a long-sleeved fluid-resistant or impervious gown. Both of these gowns are acceptable to use as each one offers the same protection. Goggles, a visor or a face shield. Disposable nitrile gloves, sterile or non-sterile, depending upon the procedure, and a P2 N95 respirator. We will now demonstrate how to don or put on your personal protective equipment. Step 1. Perform hand hygiene. Alcohol-based hand rub is fine, but if your hands are visibly soiled, use soap and water. Next, put on your disposable gown. Secure the gown at the back of the neck and at waist level at the back. Step 2. Don your P2 N95 respirator. Grasp the respirator in both hands, separating and stretching the straps at the same time. Secure the fit with the strap at the crown of your head and the second strap around your neck. Mold the nosepiece around the bridge of your nose by pressing down both sides of the nose with your fingers until you have a good facial fit. Each time a P2 N95 respirator is put on, a fit check must be performed before entering the work area. Check the positive pressure seal of the respirator by gently exhaling. If air leaks out around the nose, readjust the nosepiece. If air leaks out around the edges of the mask, readjust the straps. Repeat the checking process after any adjustment is made. Check the negative pressure seal of the respirator by gently inhaling. If the respirator is not drawn in towards your face, readjust the respirator and repeat the process or check for defects in the respirator. Step 3. Put on eye protection. This means using goggles, a visor or a face shield. If a face shield is used, the top edge should rest above your eyebrows but below your hairline on the forehead. Step 4. Don a pair of non-sterile nitrile gloves. These need to be available in the correct size. However, if sterile gloves are needed for the procedure, a pair of correctly sized sterile gloves should be placed in the room with the already prepared procedure equipment. Check the integrity of all gloves to ensure there are no tears or holes. Ensure the gloves cover the cuffs of the gown fully when donning is complete. Before entering the patient's room, you should now check that all items of PPE are correctly in place. This is done by making sure that the gown is secure at the waist and neck. The respirator is correctly fitted. The eyewear is in position and the gloves cover the cuffs of the gown. Once you are happy that all steps have been completed correctly, you are now ready to enter the patient area. Remember, you cannot adjust your mask once you enter the patient's room. If the mask is compromised in any way, you must immediately leave the room and follow correct doffing guidelines. We will now demonstrate how to doff or remove your personal protective equipment. Doff or remove your PPE either in the patient's room near the doorway or just outside the room, depending on the location of the clinical waste bin. Step 1. Remove your gloves. One by one, grasp the outer edge of the first glove close to the wrist and peel away from your hand, turning the glove inside out. With the remaining gloved hand holding the inside out glove, use fingers on the now bare hand to reach under the edge of the second glove at the wrist. Without touching the outside, peel the remaining glove away, turning it inside out as you go. Carefully drop both gloves into the clinical waste bin. Perform hand hygiene. Step 2. Remove your gown. With your now bare hands, reach behind your head to release the gown closure at the back of your neck. Do not allow your sleeves to touch your face or head, or your hands to touch the front of your gown. Reach to the back of the gown to break or untie the belt. Do not touch the ties in the front. Using both hands, take hold of the gown edge at the back of the neck and peel the gown away from you, turning the gown inside out as you go. Carefully fold or roll the gown into a bundle, taking precautions not to touch the outside of the gown as it is contaminated. Place the rolled up gown into the bin. Perform hand hygiene. Step 3. Remove your eyewear. Remove the eyewear by leaning forward and gently lifting the goggles, visor or face shield off your face. Pay particular attention to avoid touching the eyewear with any part of your body. If using a full face shield or completely disposable goggles, carefully place the eyewear into the bin. If using a visor with disposable eye shield, use one hand, grasp the visor frame behind the ear, slide the disposable shield off the frame and place into the clinical waste bin. Use a neutral detergent surface wipe to thoroughly clean the frame before placing on an uncontaminated surface. Perform hand hygiene. Step 4. Remove your respirator. While leaning over the bin, tilt your head forward a little. Use both hands to grab the straps at the back of the head. Stretch the straps outwards at the sides, then lift the straps up and over your head. Keep hold of the respirator. Do not allow the respirator to touch any part of your body or clothing. Carefully drop the respirator into the clinical waste bin and close the bin. Perform hand hygiene with hand sanitizer or soap and water.